specific groups. And then afterwards, we will have a student panel to further discuss how the virus has amplified social and racial disparities. And then we'll also discuss how the COVID-19 virus patients have experienced discrimination. Okay, so Alexa, if you could start our PowerPoint.
Yes.
Thank you.
And Alexa, if you don't mind, would you be able to record it for me? Because apparently I don't have the right permission. I'm sorry about that.
Yeah, it's okay. I just sent you an answer.
Awesome. Thank you.
Yeah, no problem. All right. Share screen. Okay.
All right, wonderful. And you can go ahead and advance the slide, Alexa. Thank you. So glad to have everyone here with us today. Back in early March, we developed a presentation that Dr. O beautifully delivered on how the COVID-19 virus has been racialized and politicized. And as you see here with some of the headlines we took from that time, racist attacks on Asians spreading faster than the coronavirus, how COVID-19 coronavirus is uncovering anti-Asian racism. This was very important for us to talk about at that time and important for us to talk about right now. And we asked the question, are we always looking for a scapegoat? Go ahead, Alexa. So right now, as we have been enduring during this pandemic, we understand that not only has the disease been racialized, but that so many marginalized groups have been disproportionately impacted by COVID-19. We are going to be discussing examples of how that is impacting for specific groups, the Native American community, the African American community, the Latinx community, and the Asian American community. And as we see from the slide here, that the numbers of reported deaths from COVID-19 are significantly high for the African American community, as well as for other communities of color.
Before I get started, Alexa, I do notice that the PowerPoint isn't in full. Yeah, thank you.
Yeah, I clicked on the wrong thing. My apologies.
That's okay. No, thank you. All right. Well, first, I'd like to discuss about how COVID-19 has negatively impacted Native Americans, specifically the Navajo Nation. The Navajo Nation is located across 3 states, so specifically Arizona, Utah, and New Mexico. And overall, the Native American people are being infected and dying at rates that are above the US averages. So in fact, the Navajo Nation has one of the highest rates in the country, only behind New York and New Jersey. And then these individuals also have the added challenge of having limited access to care and supplies. So they're currently experiencing or living in an energy, food, and healthcare deserts. So I would like to talk a little bit further about their limited access to care and supplies. Alexa, if you could move to the next slide. All right, well, first, many of these households lack internet access. So getting out information about social distancing is a challenge. And due to not being able to have access to running water, it is estimated that 30% of the homes on the Navajo Nation, they don't have running water, so it's difficult to wash your hands. And even at hospitals, many Native American hospitals are not equipped with enough medical supplies, such as ventilators, which again, they're experiencing limited access to both care and supplies. The Navajo Nation has been they've been affected the worst, but other tribes are facing the same threat. In New Mexico, we have the native Pueblo communities. In the Red Lake community in Minnesota, they have enforced a mandatory quarantine, restrictions on gathering, and limited travel to and from the reservation, containing their spread to one person. However, overall, the health disparities laid bare by COVID-19 have reverberated across the Navajo Nation and other tribes since the time of European colonization. And we can see this with the H1N1 flu and the Spanish flu.
May I mute myself? Okay. Let's talk a little bit about the impact on the African American community. As we see here, the CDC found that 33% of people who have been hospitalized with COVID-19 are African American. However, African Americans only make up 13% of the entire United States population. And we see here on the slide several factors to try and explain why this is the case. You can go ahead and advance the slide, Alexa. So as we look at the impact on the African American community, I think we have to really first begin with the acknowledgement of the inequities regarding access to quality health care and the historical, institutional, and structural racism embedded in our systems that breeds and promotes bias in healthcare delivery. And moreover, other institutional factors such as access to adequate food, adequate, affordable, and quality food, as well as housing, also play a significant role in why this community is disproportionately impacted. Even looking at the numbers of people who have tested positive for COVID-19 and have died from the virus right here in Wyandotte County, we see that these are members of our community who are majority African American, and that should cause us all pause. And then finally, we pulled this headline here at the bottom. I want to stay alive, but I also want to stay alive. And this is a headline that's talking about the video of police following Black men wearing masks and raising more concerns about racial profiling. So we see that in that headline that even in the face of a worldwide pandemic, when everyone is being told to wear masks in order to keep others safe, there are clear examples of how African American men specifically are being discriminated against and targeted for harassment and violence because they are wearing a mask to keep others safe. Here we just put in a slide that goes through the end of April, talking about the percent of COVID-19 deaths in relation to the African American population.
So even looking at the Latinx community, these individuals are disproportionately getting sick from the coronavirus. In some regions, they're being infected and hospitalized at up to 3 times the rate of white Americans. However, the official statistics may be underestimating the virus's toll on these communities. These individuals may be worried to seek out medical care due to lack of health insurance or fear that they'll be exposed if they are undocumented. And also Latinx individuals have the highest uninsured rate of any racial or ethnic group. And even though their taxes are deducted from paychecks, undocumented people typically cannot benefit from unemployment assistance, nor will they see stimulus checks that many Americans will or have received. Also, due to the economy, many have no choice but to return to work and risk their lives at frontline jobs, and generally the lowest paying frontline jobs. And according to the Pew Research Centers, Latinos Latinx individuals disproportionately say that they are, or someone in their household has taken a pay cut, lost a job, or both since the pandemic. And again, this picture shows the percent of COVID-19 deaths. So for example, when you look at New York, Latinos comprise 19% of the population, but have suffered 26% of the deaths. And overall, for each 100,000 Americans, about 15 Latinos have died from COVID-19.
As we think about what we've presented so far, I really want to emphasize how those structural, those systemic racial barriers in our communities just really wreak havoc on a community and impact why populations are so disproportionately affected with the virus, especially as we talk about when you have communities that don't have access to resources, that don't have access to affordable health care, that don't have access to housing and food, as we were talking before, and who are still, I know, among with the other populations, losing their jobs. And these are folks then who have to, or who are already were working on the front lines. I know we've talked about the front lines a lot being in the hospitals, but this is a pandemic where the front line actually is all across the communities. And so these are the people that are working in the food service industry. These are the people that are the sanitation workers that are coming to take your trash every week. And I know all of us appreciate that. These are the people that are driving the trucks that are delivering our packages. These are people that are stocking the shelves in our grocery stores. And so these two are frontline workers. I've included here a couple of slides, I think, to kind of help set up our student panel as well. I wanted to get some words from those who are in this traditional student age. And these two examples specifically talk about discrimination against Asian Americans. Right here, it's titled, "You have Corona." At school, someone made a joke, in quotes, "You have Corona." Even though it was meant to be fun and just a joke, I found it to be racism. An elderly woman looked at me intensely in the Munich subway. Shortly thereafter, she pulled her scarf to protect her mouth and nose and quickly passed me. I was having dinner with my brother, and on the way home towards the subway, two young people shouted at us, "Corona." What remained in me after these three encounters was a bitter aftertaste. When I'm in public, I feel watched and uncomfortable. On the train, I have the feeling that nobody wants to sit with me because of my Asian descent. A constant feeling of malaise, exclusion, and anger accompanies me. And this is from Claudia. And if you could advance the slide, Alexa. Yiwan from the USA says, "I never had to worry about avoiding others to make them feel safe." And I want that to kind of settle with us. I never had to worry about avoiding others to make them feel safe. It's amusing how the virus is less discriminatory than some people. Right now, if you can go ahead and advance the slide, Alexa, we are going to turn the remainder of the presentation over to our Student Diversity Council, and they will introduce themselves and take it from here. Thank you.
Thank you so much, Dr. Sparkman-Barnes and Dr. O, for that enlightening presentation. My name is Beth Liu, and I am one of the co-presidents of Student Diversity Council. Here you can see the rest of our executive board members, and to tell you about a little bit about who we are. This year, we are focusing our initiatives on connectivity. So we want to offer a space that embraces diversity, empathetic engagement, really because we value the unique experiences of individuals here at KU Med, and we are eager to hear, understand, and share their stories. So today, we have a panel of students that will share their stories and those of specific populations affected by COVID-19. And then afterwards, we will have an open discussion led by our other co-president, Diana. And please keep your questions and comments until after the panelists have spoken. Feel free to post in the chat box any questions or comments that come up, and we will address them afterwards. And so our first panelist is Christina Haswood, who is a student in the Population Health Program here at KU Med. So Christina, if you want to go ahead. And here are our panelists today.
Christina Haswood. I'm in the Department of Population Health. I'm a master's in public health student with a concentration in management. And I will go ahead and talk to you guys about how my people, I'm Navajo from the Navajo Nation, originally from Inscription House, Arizona, and how we've been affected, and particularly to COVID-19. So as we see here, this is the student panel, including me. I'll be going first. So if you want to go and advance the slide. This is kind of where Navajo Nation, it's actually located in the Arizona, New Mexico, Utah area, in the Four Corners area, the Southwest. And as you can see on the left side, Page, Arizona is next to Utah. And on the right side, we have the map of the Navajo Nation Reservation, and we can see that Navajo Nation is the largest tribe landmass-wise. It's about the size of West Virginia, the state. And then we can see that there's border towns. So Page is on the upper left hand, on the right side diagram. And the border town reservation relationships aren't the best, actually. It's a lot of, I guess, racial aggression towards each other. And then the next two experiences happened this past month, one this past weekend. I'll go ahead and share. If you want to advance the slide, please. So the first situation happened in April 2nd in Page, Arizona, where a man posted on Facebook, and on the right, we have the exact quote from the Facebook, misspellings and all, where he said, "Danger, danger, if you see these Navajos anywhere, call the police, shoot to kill these Navajos. They're 100% affected with the coronavirus and need to be stopped with lethal force is authorized. Page, Arizona do not need the spreading. Stop these people in any way. The Navajo police are not taking responsibility." So he posted this on Facebook, and I believe that day he actually got charged with suspicion of attempting to incite an act of terrorism. And then he was booked into Coconino County Jail with a Class 3 felony. At this time, the Navajo Nation had 380 COVID cases and 19 deaths. And then next slide. The second incident happened this past weekend, where the mayor of Page posted an insensitive Facebook comment towards the Navajo Nation president. So on the right, we have the exact screenshot of the comment coming from a bigger post where the Page of mayor wanted to work with the Navajo Nation. He signed this like press release, and he posted on social media saying where he wants the Navajo Nation to work with him to reopen the tourism sites near Page, Arizona, like Antelope Canyon and Horseshoe Bend, which are run by the Navajo Nation and are currently closed right now because of COVID. And then somebody posted on his press release, "He's busy fighting hard for our people." And this is a picture that was taken at the end of last week that's been kind of circulating around, kind of showing how our Navajo Nation tribal president is at the front lines with protective gear and all. And you can see the vulnerable population of our elderly. He's kind of like touching hands and saying like, it's okay. It's a very powerful hope sense of picture. And then below it, the mayor responds with, "I wish you would battle alcoholism as hard as COVID-19. And he inserts this picture, which is kind of socially with Native American and alcoholism issues. So that was the situation. And then the Navajo Nation president actually responded on Monday saying that it is not time for us to lower ourselves to these type of comments, but to reunite and to fight these monsters that have come into our communities. So this is, the mayor apologized. He insists that he was not being racist. He says that in my comment, I did not put a race in, so I was not being racist. And a lot of people are telling him to resign. He's like, I don't need to resign. So this is all because of, they wanted to open the tourism spectrum in Page area. The next slide. What the statistics are now, so on the top, 3,497. This is all tribes all over in Indian country have confirmed COVID cases with 104 deaths. Then you can see in the picture below is kind of the hot spot. The big red dot is near Native Navajo Nation. And then we have like Pueblo and the Apaches down there. And then we have other hot spots in Oklahoma and North Dakota. And currently today, there's actually 2,474 cases on the Navajo Nation reservation with 73 deaths. And then yesterday, the Trump administration said that they'll give $600 million towards the Navajo Nation. But that's talk now, we're waiting for action. And then Native Americans face everyday microaggressions in border towns. People like me who live in the urban area live in Lawrence. It's not too bad, but I can't say that for the rest of the natives who live in other urban metropolitan cities. Hand it over to Ram.
Hi, everyone. My name is Ram, and I'm a first-year medical student and a member of the Student Diversity Council. And I just wanted to speak a few words on the effects of stigma on coronavirus patients. So patients who are diagnosed with COVID-19 face a powerful stigma that may cause them to be ostracized by their community. According to a recent Psychology Today article about the effects of coronavirus on public perception, they mentioned two types of stigma. The first one is public stigma, where people reinforce the idea that individuals with COVID-19 are tainted and thus exclude COVID-19 patients from the community. Now, the second type of stigma is internalized stereotypes, where a person feels ashamed of being diagnosed with the disease. This could ultimately lead to something called label avoidance, where people will try to pretend to not have the disease or avoid testing just so that they will not have the label of COVID-19. With this in mind, how can we make community members with COVID-19 feel connected to others while also respecting quarantine and isolation? So according to a document from the World Health Organization, the social stigma associated with COVID presents a public health risk for people around the world. If people are too afraid to get testing or practice safe social distancing, even if they suspect they have coronavirus, it'll be difficult to flatten the curve domestically and around the world. Thus, they give great recommendations for how we can lower the stigma, which I'll now present. One of their first recommendations is to not refer to COVID-19 patients as victims, but instead as people who have COVID, are being treated for COVID, or are recovering from COVID. Next, we shouldn't talk about how people transmit or spread COVID, but instead talk in the context of people acquiring or contracting COVID. They also recommend not using hyperbolic language such as the plague or the apocalypse, but instead talk about COVID in a scientific fashion. We should also emphasize the importance of protective measures such as quarantine and PPE to family and friends. Using terms such as COVID-19 or coronavirus instead of terms such as Chinese virus to try to avoid tying ethnicities or locations to the disease. And then finally, speaking positively of people who have recovered from coronavirus and learning about their personal experience to build empathy and understanding of the disease, such as how we're doing now. So while these suggestions from the WHO may seem like minor things, they can have huge impacts on making COVID patients feel respected and included. This is especially important in a research community such as KUMC. According to an editorial in Nature last month, they discussed how certain groups such as Chinese, Japanese, Indian, and South Korean researchers have felt discrimination when trying to publish in international journals. And stigmas associated with coronavirus may continue to raise these barriers for the scientific community. Thus, we can all see the importance that reducing stigma can not only benefit patients with coronavirus, but also indirectly benefit others without it. I'll now pass it on to Diana for further comments and statements.
Hello, everyone. My name is Diana Seville, and I'm a fourth-year PhD student in pathology and laboratory medicine. And today I'm going to talk about how COVID-19 has impacted the low-income populations. So while the virus has infected people regardless of their racial identity and wealth, we can see that low-income populations are to this day the most affected. Some of the reasons for these are long-standing segregation by income and race, and also the high cost or accessibility to medical care. So specifically, how are low-income communities impacted? Well, first, they're more likely to be exposed to the virus. They have higher mortality rates, and also they have the higher burden economically. And also these vulnerabilities are more pronounced for marginal groups that are identified by race, gender, or immigration status. As Dr. O previously mentioned, in the case of undocumented immigrants, there is a fear of seeking medical care due to deportation. And also there is a lack of knowledge of the language and where to get tested. And this makes these populations more impacted. Now, there has been said that the US government needs a response to the coronavirus that prevents people from having to choose between a measly paycheck and risking their families and their health. Low-income jobs in fields like retail, hospitality, childcare cannot be performed remotely. And in the US, the majority do not offer paid sick leave or health insurance. Also, according to the Human Rights Watch, most than 40.6 million people are living in poverty in the US, and they do not have savings to weather a lack of income or even stocking up on food, which can represent an impossible financial hurdle. Additionally, we can see that the US economic inequality is closely linked to racial divide and income and wealth. Incomes and wealth are lower, and poverty is more acute among Blacks and Latinos. About 21% of Black people and 18% of Latinos live under poverty line. And this is compared with 8% of white people. And we have also seen that past recessions have disproportionately affected Black and Latino families, partly because they have less wealth to fall back on. And due to the lack of resources to prepare and protect against the coronavirus, low-income people face a higher risk of contracting and subsequently spreading the virus. They cannot prepare financially, they cannot get access to food or medical care, and also multiple family members might become laid off. So in closing, I just want to share like a personal thought. And is that during this pandemic, I often think and look back at the time when I was first generation immigrant, when I was homeless, trying to go to school and working multiple jobs, including construction at a restaurant just to make it. It makes me very grateful to realize how now I am so blessed and privileged to have a roof over my head, access to food and healthcare, and even to pursue higher education and the ability to work from home. But I also think about those who are less fortunate and still struggle daily, even more now during this pandemic. Therefore, my invitation is for all of us to use our place of privilege to make a positive impact on those that are in need by either volunteering, donating, or sharing some of our blessings. And finally, I can call all of us to not allow our privilege to cloud our empathy towards others. Thank you. And now I hand it to Beth.
Thank you, Diana. So as I said before, my name is Beth Liu. I am a N3 student in the School of Nursing, and I am Chinese American. My heritage has been a source of pride, especially growing up when I learned that my uncle was a member of the United Nations Council, and my grandfather, Dr. Chen Liu, founded the infectious disease department here at KU Med. And then when I got older, I didn't understand, and I was even a little resentful of my yaya and mama, my grandparents, that they only spoke English to their children, ensuring that my father and his siblings wouldn't know Chinese. And I felt like I missed out on a big part of my heritage. But now I understand, because today, like when my grandparents immigrated during World War II, it's a scary time to be Asian American. A time when xenophobia runs rampant, like in Dr. O and Dr. Sparkman Barnes' presentation, the examples, I mean, in addition, a New York woman was taking out her garbage and a man threw acid on her face and arms. And in Texas, a man stabbed 3 people, including a 2-year-old, simply because they were Asian American. These hate crimes can also be found here in Kansas. The discrimination, for example, there's a Kansas chairman of commissioners in Riley County who stated that Corona isn't a problem locally because we don't have a lot of Chinese in central Kansas. It's just, I mean, even here at KU Med, there have been instances of discrimination and racism experienced by members of our own community. And I'm afraid that as the stay-at-home order is lifted, these instances are going to increase. And really, these stories, they reflect the foundational roots of America, how with the opportunity for freedom, there also comes xenophobia, discrimination, racism. And I think right now, more than ever, it's important to center our narrative, our American narrative, on our own stories. So we have a voice, especially right now in the age of social media, and we need to use that voice to tell our stories, to denounce hate, even if you don't deny or don't identify as a member of these populations that we talk about today. We still need to join together because unity is our strength. And we'll be adjusting to a new normal. So let's make that a new, better normal, learning from America's history, our past, our present, and make tomorrow better. So with that, I'd like to open up for discussion. Diana will be leading the discussion for everyone to join in. Thank you.
Thank you, Beth. So I just wanted to know, like, if there are any questions or comments. I didn't see any questions on the chat, but one of the things that I've been thinking about is that now that some of us going back to work and the social distancing measures are becoming relaxed, I wanted to ask everyone, what do you think is the best way for all of us to remain connected going back during social distancing, meaning we're all going to go back to work, but still we'll have to experience social distancing. What is the best way for all of us to remain connected?
Diana, this is Geraldine. First, I want to thank everyone for a great presentation. It was very informational, so thank you for your work on this. I think one of the ways, I think there's actually several ways that we can stay connected. I think that as we come back to work, we'll need to keep our distance from one another. I think that we should continue to meet, even if we're in our offices over Zoom, that we should continue to meet. I think we should randomly email each other, call each other, but also send your colleague or your peer a note in the mail, even if it's something really quick, just to send it to them. I think there are several ways that we can stay connected. I think it's so important for us to collaborate. Again, I'll say it, all ships rise when we come together. So collaboration is key in the midst of what we're managing in COVID-19. So I think that there are several ways that we can stay connected. But I think it's important for all of us to put forth the effort and to think about your colleague or your peer, someone you haven't seen or talked to in a while, maybe check in on them, but several ways.
Thank you, Dr. Maggie. I think those are very good ideas. And I think that one thing is to be isolated or quarantined in your house and not have contact with anybody. And another one is to go back to work and seeing the people, but not able to talk to them. So I think that those ideas are going to help us, because sometimes it could feel more isolating to be around people, but not really being able to get closer to them. So I think that's very, very good. Another question that I have is like, what do you guys think is the best way to support each other? And if, you know, once we go back to work, you see a coworker or a student that probably is positive for COVID-19, how do you think is the best way to support that person, or just like to support each other?
Diana, this is Geraldine again. I don't mean to hog it, but I had this situation last night, literally with a student. I was teaching last night, and one of the students said that she didn't feel well. And, you know, I didn't gloss over it. We actually, as a group, we talked about it since she, you know, she brought it up. We encouraged her to get tested because she is on the front line. But also we wanted her to know that if she was positive, that it's not a dirty thing. And I think it's so important for us to get that message across, especially for those who are on the front line. So I think it's important for us to support each other in that way, to really talk about those things if they're brought up, and support one another and get that message out, especially for those individuals who are on the front line. So I thank you for asking that question, because I just had that come up last night. And so I didn't gloss over it. I addressed it with the student, and all of us supported her and to get tested, and she felt much better at the end. But I was glad that she was vulnerable enough to say, I'm not feeling good, please forgive me. And that's what opened it up.
Thank you so much, Dr. Maggie. Yeah, I think that one thing is to see it in the news, but another thing is to have somebody close to you, or even, you know, like a student or a coworker that tests positive, because you have this feeling of that you don't have the power or anything to help with the situation. So I think that's very good, and that's something that we all have to become comfortable with, is to have these conversations and to like identify ways that we can like support these students or these affected individuals. And another question that I had for you guys is like, how do you guys think that unconscious bias play a role in our response to this pandemic?
Hi, Diana. Hello, everyone. My name is Chito Belches. I'm one of the faculty at the School of Nursing. I just want to go back to your earlier question, Diana, about how do we try to reconnect after this event and then after the social distancing mandate that had been part of our mitigation process. Yesterday, well, I think it's connecting and maintaining that connection is more skin deep for me. And I would use the example of what we had yesterday when we have the Jayhawk virtual coffee. Mm-hmm. I think I felt more closer to the group than before, because we were allowed and given the opportunity to really get to know each other more than what we do at the medical center. And I felt more connected to them, even virtually. And I do same way in terms of how I connect with my students, other than just a number of students in the class that I'm teaching. It's really making that intentional practice to really get to know that individual. And I think that's how we should be able to approach each and everyone. Not only where you come from or you speak English very well, but more skin deep, more about who they are as a human being, and how do we make that connection intentionally. So I just want to add that at that point. And yesterday was a great, wonderful example of how we were able to initiate that process.
Yeah, thank you so much. Sorry, go ahead.
This is how, yeah, I second Kiddo's comments a lot. I've been in States for 30 years, and I did see unconscious bias is there, or either consciously or unconsciously the whole time. Just a matter like if you really get to the human level and understand each other's culture and where you are coming from as human being, that barrier will eventually disappear. Of course, what we are doing here is really important to raise conscious and to do active work to overcome that. But just to talk as human beings and understand each other probably is really the first step, because everyone has the same concern, difficulties, an unknown challenge. For example, coronavirus has no prejudice against one group or the other, against the other. So we are essentially at with the same risk, and everyone essentially in this a similar situation, no matter whether what kind of ethnic group you come from, or socioeconomic group. Of course, some will be suffering higher risk, but at the same time, I do see over the time the prejudice against Asian group or minority group compared to 1940s, for example, has hugely improved, but still a lot of work to be done. So I guess the most important part really is to open dialogues and treat each other respectfully and at a human level, more or less.
Absolutely. No, I agree. Thank you so much. I know that we are coming close to time, so I'm just going to hand it to kind of share briefly some of the events and upcoming things that we have. So if you could help us with the last slide, please.
Hi, so I'm Kathleen. I'm just going to announce some of our events. So so this month is Asian Pacific Islander American Heritage Month. So we have a couple events here. One is I'd like to direct your attention to the APIA Heritage Month Research Day. So if you know, or you are an Asian American who would like to, or Pacific Islander who would like to present your research, you can email Dr. O and get more information about that. And that'll be on May 20 from 10 to 1. And if you'd like to tune in, there's the, there's the link down there. And also we have some biographical posters of researchers, faculty, and staff that are Asian and Pacific Islander American researchers. And these posters are available to view online and will also be posted on our social media. And then our social media is on the right over here with, you can follow us on Instagram or Facebook.
So, I also want to say thank you again for our Student Diversity Council, our panelists, and also the Office of International Program for this opportunity to work collaboratively to have this much needed discussion. Overall, I would like to encourage everyone to, there's that temptation to divide ourselves into this us or them, but I hope that, we are able to, all work collaboratively, work collectively, and also we can all refuse to embrace stigma. So, I hope that everyone got a lot from this event. I learned a lot, and it was really great to meet everyone. Thank you for sharing our future events for Asian Pacific Islander American Heritage Month. I hope to see everyone at our next event, which will be happening in 2 weeks for our research day. But yes, if you would like to learn more about our Asian Pacific Islander staff and faculty, please feel free to visit our biographical posters on our diversity page. Thank you, everyone.
Thank you so much.
Yes, thank you.
Have a great day.
Yeah.
Thanks,
Have
everyone.
a great day, everyone.
Thank you.